Hello, I am Dr. Carolyn Eaton, and this week in medicine, I am talking about knee pain. Now, because I'm talking about a specific illness, I need to give a little legal codicil, this is for educational and entertainment purposes only, and it is not a substitution for a consultation with your physician. All right, so let's talk about knee pain. So what causes a knee pain? Well, most commonly people think about acute trauma. So you fall, you land on your knee, you scan the knee swells up a little bit, hurts for about a week or so, and then heals up and is fine. But there's a lot of things that will cause chronic daily knee pain. And chronic daily knee pain is knee pain that occurs more than 4 days a week for more than 12 weeks is the definition for chronic knee pain. And most common cause for it is osteoarthritis. The things that cause osteoarthritis oftentimes do occur in younger years. Severe trauma to the knee, tears in the knee, multiple tears in the menisci, and unfortunately, sedentary behavior. One of the major risk factors for chronic daily knee pain is sedentary behavior for more than 10 hours per day. Even if you're active other times of the day, if you have about 10 consecutive hours of sedentary behavior, which is basically less than about 100 steps an hour, then you are you can't ever say definitely in medicine, but you are at a much higher risk of developing chronic knee pain. Now, it used to be we thought that joggers would all get knee pain. Oh, you're doing all this trauma to your knees. It's going to cause you to have chronic arthritis of your knees. And it turns out the opposite is true. People who are joggers and runners are at a much lower risk of chronic osteoarthritis than people who are sedentary. And one of the reasons for that is that trauma to the knee that you have when you're jogging and you're pushing on it, you're actually remodeling the soft tissue of the knee and actually recreating new cartilage, and is very beneficial. They even did a study about 2 years ago now on people who were preparing for the very first marathon. And they were basically studying the people that were like the Bridget Runs a Marathon movie, people going from a sedentary lifestyle to someone who's planning on running a marathon. And the interesting thing they found was that when they looked at the knees of those people, even the ones that had a little bit of arthritis at the start, their knees actually improved after the marathon. So it's actually, for very early arthritis, it actually is very beneficial to be out there and doing some jogging. And jogging, like Jim Fixx said, is the pace that's comfortable for you, that you feel like you're jogging. And it does not have to be super intense. You're never too fat, you're never too old, and you're never too slow. It is okay to just get out there and move. So that's my thing on jogging. I do jog, and those of us who are runners do tend to promote it a lot because it does help you feel better. Now, one of the other big risk factors for knee pain is unfortunately obesity. People who are obese are at 3 times the likelihood of developing knee pain of somebody who's normal weight. So that kind of goes into the jogging thing as well, is that getting active will help you reduce your weight, which will help reduce the knee pain. So those are great things to reduce it. And the other important thing to do is actually exercising the knee so that you're strengthening the muscles around the knee. Because another big contributing factor to chronic knee pain is weakness of those muscles that surround the knee. The quadriceps muscle in the front of the upper leg, the calf muscles in the back of the lower leg, and the hamstring muscles in the back of the upper leg, and the gluteus muscles, which are, of course, the buttocks. Those are all very important to actually help keep your knees stable and strong. And I'm going to follow this part of the talk with some exercises that help with that. Now, very important things are to stop being so sedentary. So what can you do at work? You're always on some monitor, and people are always monitoring exactly what your activity is going on. For that matter, some workspaces monitor every single keystroke you do. Well, if you can, trying to get a standing desk is actually very helpful. So you can go up and down. So you can stand for a while, sit for a while, stand for a while, sit for a while. And that helps you from that prolonged sitting. So you're actually doing some. And when you're standing, you can kind of do a little shuffly walk a little bit. So that can be very helpful. So that will help keep you from having that prolonged sedentary time. Another thing you can do is actually really adjust or look at your footwear. One of the interesting things we found is that too hard of a sole is actually very bad for your knees. Also not good for your ankles or your hips. But really hard-soled shoes are not great. You want to have shoes that have flexibility to them. Now, a flip-flop is terrible, mainly because you have to push your weight forward in them to kind of keep them on, and that can cause what we call chondromalacia, which is a type of arthritis behind the kneecap. and they're not good support. And you don't need a huge amount of support to be good for your knees. You actually want to have fairly light support because your knees do best if your feet can feel the ground. So going barefoot's wonderful. Not many workplaces are going to let you be barefoot. And the skin on your toes and your heels are probably not real happy with you trying to be out in the park barefoot either. So finding some lightweight running or athletic shoes that have just a little bit of arch support to them or you can adjust the arch support, because if you have very high arches, then yes, you need to get a higher arch support for that. But making sure you have some flexibility in the sole of the foot, in the sole of the shoe, sorry. That's a very important thing, but you want to have stability for the ankle so you're not pushing your weight forward to keep the shoe on. So actually the walking sandals that have the ankle straps are also quite good. And then the last thing to do is, actually, as I think I already mentioned, is keeping the weight down. And I'm going to actually talk about obesity next week, kind of as a codicil to this one. So that's kind of my knee pain talk in a nutshell. I'm going to do the exercises and then go from there. Have a wonderful day. Basic knee exercises. Exercise number 1, we want to do a range of motion exercise where you flex, where you bring the knee in and then extend. What you basically want to do is bring it in as far as you can and extend it out. Now, sometimes when you first try to extend out your knee, you'll find that it'll shake very badly. So what you want to do is then go onto a surface where you can push down the knee. And this will help the brain know that it's okay. If it causes a lot of pain, then don't push it down all the way. Let it stay mildly flexed. If you want to try to extend it out as far as you can. All right. Exercise number 2, you want to turn the foot outwards. And so you're really exercising this middle part of the knee. And you want to pulse it. And you want to start off doing that 5 to 10 times. Each of these exercises you want to do 5 to 10 times. Alrighty. And that strengthens this portion of the knee. And not a lot of exercises will work that portion. The next exercise are going to be squats. What we want to do is actually, you can start off just doing little bitty squats and keep your feet about shoulders width apart. And so start off with just these little bitty ones. And what that's doing is that's strengthening both your quadriceps and your hamstrings, which helps stabilize your knee. So you want to work it up. And so eventually you want to try to work your way down where you can do a full butt tap. You go to the chair behind you, tap, and then come back up. And that really is very, very good for strengthening and helping stabilize the knee. The last exercise is a lateral raise. And so you can hold on to something if you need to. And you simply want to bring the foot out and the leg out. And this will help exercise the side portion of the leg, including the side portion of the knee, and help that be stronger and more stable. And those are 4 basic exercises. They only will take a couple of minutes to do. And if you do them daily, that will help keep your leg more functional, your knee more functional by improving the range of motion. Thank you. Thank you for your time this week. Next week in medicine, we'll be talking about obesity. Have a great week. Stay safe, stay healthy.